regarding the problem statement and purpose statement. First of all is in my voice thread slide 5, I have emphasized that the problem statement is the prelude for the purpose statement. And this is very important because the purpose statement serves for the problem statement. And they should be consistent. For example, little is known about the factors affecting breast cancer survivors' occupational functioning. This is a gap in the problem statement. And in the purpose statement, I probably should attach my original publication. The purpose statement is to identify the variables describing the barriers and facilitators associated with return to work. That's basically state about the purpose, that is to identify the factors that associate with return to work. And another example is from your textbook. The side effects of chemotherapy is a topic which you have posted last week. And the problem statement is interventions have been only moderately successful, and so new interventions need to be identified. That's a gap in the problem statement. And the purpose statement is to compare the effectiveness of these two types of intervention for controlling the side effects. So, say the purpose statement is consistent with the problem statement. And it's very important you draft the problem statement first and then the purpose statement, and place the problem statement in front of purpose statement. The order should never be the other way. And the second issue I want to provide more information is about how do you find the gap. And ideally, it's from your practice. And for example, the nurses practice with a urinary catheter, and they may question should they really place a urinary catheter to the patient, because the catheter could cause some side effects. And so that's make them probably start to search for articles and evidence, say how other researchers and nurses make decisions when they have patients that may need a catheter placement. And for you, if you don't have enough practice, or you have practiced but didn't pay attention to any questions, and there's other way you can find the gap. You can ask your clinical instructor what question they may have, or you can find the theory. I would say the easy way in this class is doing a literature search, which is a skill that you learned from last week. So how do you identify a gap from those literatures? So for example, those are the articles I pulled based on the key words that are searched in the database. And you don't need to do that much. You just find a couple of them until you find a pattern or question. For example, I'm going to randomly just pick a couple of them. Those are all find based on the keywords I searched from the database. So the first one I would say, let me say this one. You always can come to the abstract. And for this one, it says the the aims of this study were to generate knowledge about factors predicting return to work among women. So they're looking at factors. And you may find another articles also looking at predictors, which is the factors. Let me look. So their objective is, the aims of this study was to assess factors predicting return to work. So, and you keep looking, maybe a third articles, and they're looking at this preliminary study aimed to explore the factors that influence decisions about return to work. And you look at all these articles are talking about the factors. However, the outcomes may be different. So you could come up with a gap, that is to identify and synthesize the factors that affect women's return to work after breast cancer treatment. And the gap would be, there's no clarification of information how and what factors influence on women's return to work, because each study they have different outcomes. So you would do is to synthesize the evidence from all those studies that you find. And if you are even feel this way is challenging, I would suggest you do a literature search specifically on an article that is literature review or systematic review. Because actually you are pretty much doing the similar thing. And you could ask the librarian for help if you give them your topic and the keywords. And for example, this article, look at this literature review that I found based on this topic. Searched on the keywords of return to work and breast cancer survivors. And usually introduction would be their problem statement or background. And what their gap usually will be stated in the introduction. For example here, there is no clarification on current literature showing the relation of physical compliance in working among breast cancer survivors. And their purpose would be aims to synthesize the information about physical symptoms in work relations among breast cancer survivors. And this will be something that you will be doing. And for learning purpose, I don't mind you are using the same gap and the same purpose statement. And your research question may be different or it may be similar that you'll be drafting next week. However, the articles that you find should be different than the original literature review. And of course, the metrics should be different because you are looking at something additional or different variables that we'll be talking later. And in case you did use the literature review, and please cite in the in your draft. And that's basically two things I suggest when you are doing the purpose statement and the problem statement and purpose statement that due this week. And I will give you feedback next week.